My name is Dr. William Al, go by Bill, and I'm a neurologist. I've been practicing neurology in Sacramento since 1979, so it's quite a few years. I first became interested in dementia maybe about 15 years ago when I noticed that my patients are getting older, and there are more and more complaints of memory impairment, not only from the patients that come to see me, but from the families of patients who notice a problem. I looked at what we could do for these folks, and really at that time there was precious little. So I started doing actually some clinical research and looking at new drugs that could help these folks. And as I did more clinical research, I started accumulating more patients with dementia and Alzheimer's disease. And that's how my practice became known for looking at patients with dementia. So what is Alzheimer's disease? Alzheimer's disease is an acquired progressive disorder of the brain, characterized by loss of memory, loss of self, personality, and lost ability to do routine daily function to take care of oneself. It's not memory alone, but the ability to deal with people, to make rational decisions, to have good judgment. Frequently, language is involved, so the person has trouble expressing their thoughts. Now, we all have tip of the tongue syndrome. Sometimes I can't find that word, but it'll come to you in time. And with Alzheimer's patients, it doesn't come. And this gets more and more, and so as time goes by, so the family realizes, geez, Dad's really having trouble expressing himself. And that's frequently a tip-off.
Well, I've been in sales for a long time, and I was selling cars the last couple of years before I decided to go to the doctor about this. And I sit there and take an application or meet someone out to show them a car, and they'd tell me their name, and I'd turn around and I wouldn't know their name. And we'd sit there and talk, and I would say your husband instead of saying it was Ron or whatever. I'd always say your husband or your wife, and they'd always correct me, and I'd feel like an idiot because I couldn't remember their name. I guess during this time, the sales manager, the manager of the whole dealership, noticed that a few of these things were happening. And I'd go in and sit with the sales manager and go through the application and what the people want to do, that kind of stuff. And I couldn't bring up some words I wanted to use. And I was getting mad at that a little bit mad that I couldn't remember the stuff or do it.
The biggest thing that made me really realize we were in trouble and we had to seek help was there was this particular evening when Nelson came home from work, and I had said, I'd like you to help me feed our dog. And we were at that time rescuing greyhounds and having a really great time doing that. And I hadn't noticed anything really that I could put my finger on that made me say, wow, I mean, wow, until this happened. And Nelson was helping me at the sink, and he was stirring the food, and we fed her. And I said, I'm going to put a little cheese in it. And he took the food, and he set it down, and he patted her on the back and said, okay, baby, you can eat now. So that was fine. We got it done. We had our dinner, and we went and sat down. Pretty soon, we were sitting and watching TV, and Nelson jumped up out of his chair and said, oh, my God, we forgot to feed the dog. And I said, oh, honey, not a big deal in the beginning. That is not a big deal. I said, honey, we already fed her. It's okay, we got it taken care of. Oh, okay. And he looked a little puzzled. So we sat down again and started watching the show again. Pretty soon, it was probably maybe a half an hour, he jumped out of his chair again and said, "Oh my God, we forgot to feed the dog. She must be starving." And we had a certain time that we were supposed to do this, and he remembered that. And I said, "Nelson, no." I was becoming a little concerned now. I said, "Honey, no. We fed her. It's been about an hour ago or a half an hour ago. She's fine. We're okay. Why don't you sit down and relax?" We did again. About another 45 minutes. The third time, he jumped out of his chair, very upset by this time, and said, "We forgot to feed the dog." And I can tell you very frankly that this particular instant, my whole life changed.
Back before this started, at the last dealership I was working at, I didn't have the confidence to do anything. I was there. I knew what I had to do. I knew how to do it. I just didn't want to talk to people sometimes. I didn't want to meet and greet. I don't think I knew that something was happening when that was going on.
Nelson's considered early onset, which is a good thing. We caught it really quick. He's on 3 medications. But the family was prepared to see, I believe, this drooling, incapable of recognizing, not able to care for himself, hygiene-wise person that is just not this. And as I say to myself and God every day, I keep waiting for the other shoe to drop, because that person is not Nelson. Nelson has a lot of problems that he doesn't always realize or own up to, but it's not like what you see in the movies. His situation is quite different. He's doing very well. And every day there are 1,000 little things that the family notices, and we talk about it. Nelson's been pretty good. He's been very good about allowing us to, we talk about it. We laugh about it. We make jokes about it in our family. And that's how we're living with it. That's how we're dealing with it.
We don't want to hide it.
No, we don't want to hide it. That would have been his folks. And our kids are, our son stopped talking to us for a while. He was very angry with us. We think it was denial. We think he was scared. But that's changed. That's turned around. And now we're living on our daughter's property, and she works full time. But our son-in-law is there, and our grandson, and they're a great support system. They're there every day if I need anything or if Nelson needs anything. But we haven't really needed anything right now. We know that day is going to come. It scares us to death to think that he will be the kind of person who doesn't know who we are. I'm sure that's going to happen, but then again,
I'm not sure it's going to happen.
I'm not sure it's going to happen. And then again, he's just remodeled our whole kitchen and done a beautiful job. Yes, yeah.
So put down the flooring.
Flooring, painting, he's done it all. Built new shelving, and he's done an incredible job. It's not something I would try to do normally, but he's doing it and doing it fine. And he went this morning, pulled money out of his bank account. He doesn't need help with things like that yet, but I hope that he never does. We just don't know. Friends have become, a lot of them, non-existent.
Forget I had him before.
Friends that we've had for 20 years, 30 years have just dropped off the face of the earth. And that, it hurts us. It hurts us a lot. They're gone. They're just gone. If I write them, they'll write back. If I call, they'll talk. But I don't hear from them. We don't. They don't call us up and ask us to do things anymore. And this hurts us a great deal.
Yeah.
A few have been pretty supportive.
Yeah, there have been a few.
Yeah, thank God. But most of our friends have just dropped like flies, and it's been pretty tough to deal with that way. You've had to give up a lot.
Oh, I go fishing, I go camping. We do those kind of things, but it's.
Well, frankly, I'd like to go back to school, but how involved do I get in that? Where do I want to start something and not be able to maybe finish it? It's just a lot of things. I paint. I'd like to do more of that, but I'm reticent to take up anything that's going to take up more of my time, a lot of, and not be able to do what I need to do for him and with him. Our time together right now is really precious, really precious. And you do have to give the time. You have to take every minute and do whatever it takes to keep you together, and it enriches every day a little bit more. And even if they don't always remember, you will always remember. And you need to spend as much time with that loved one as you can. And that's why I've given up a lot.
Mm-hmm.
It's just, you have to. It's just, you're not going to get it back. You're just not. Okay, my name is Susan Seidenzahl. My husband's name is Richard. He goes by Dick. We've been married 22 years. He's 14 years older than I am. I'm 59, he'll be 75 in September. He was diagnosed 2 years ago primarily because I was aware of a change in my own behavior towards him more than his behavior. And then I noticed that he was searching for words sometimes when he was trying to tell me about something. And I wouldn't help him find the word. I was kind of like, well, come on, you can do this, which I now know is not a good thing to do. And then he started repeating himself. But he's a very social person, very gregarious, has a great sense of humor, loves people. But he won't initiate contact with people unless they're strangers. He won't call his old friends. So there are a lot of very subtle things that you can just kind of pass off. So I wrote a letter to the physician, and I said, these are the kinds of things he's forgetting every day. And when I would say, look, I told you that 6 times today already, the hurt expression on his face told me that he really did not remember. There's a difference, between someone who's just not listening or paying attention and when someone is genuinely hearing something for the first time. I can't really tell you much about that first year. It creeps up on you slowly. But now that it's sunk in, I am experiencing what a widow goes through, and I know about that because of my father's early death, and what my mother and I went through when she suddenly became a widow. The only difference is my husband is still present, but the relationship is not the same. But he is a very independent person, very intelligent, and he is in denial about his diagnosis, and so we don't talk about his having Alzheimer's. Some people will ask him about it. My stepfather tried to interview him to help me get perspective, and so he asked him one day, well, what does it feel like to have Alzheimer's? And Dick said, well, I'm fine just as long as I take my pills. So at this stage, he is completely unaware of the fact that he will read me the same newspaper story every morning about 8 times, and I have to tell him several times a day what our plans are. And these things can be very annoying until you learn to just relax and answer the question the same way you would as if you were hearing it for the first time. And that's hard. That first year, I lost it several times. It's hard. It's very, very difficult. Having been a businesswoman and self-employed for the last 25 years, I am a natural planner. And so I thought it was important to check out every possible opportunity to make sure that he would be cared for if I couldn't do it. The best thing about his particular situation is his 22 years in the Air Force. The VA will care for him if he needs 24-hour nursing care. The question is where? The VA homes are all full. So if I have to care for him at home, I am prepared to do that, but not to the point where it's going to be an unnecessary strain on me. I've been in support groups for 2 years, and I facilitate a support group every month, and I have seen too many women who have literally almost killed themselves trying to care for someone in the 2nd or 3rd stage. It's just not wise. It's not good for the patient, and it is not good for the caregiver. So I'm prepared to do what I have to do. His 4 children are concerned, but not attendant. They know what's going on, and sometimes they're willing to help. But I don't know what's going to happen when that time comes as far as his children are concerned. I'm prepared, and it may sound harsh, but if he wakes up one morning and he doesn't know who I am, then that changes both our lives, and I don't think it's necessary for me to try to do things that I can't do as well as a care home could do. Behavioral changes in just the last 2 years. Well, during this time he has definitely lost confidence in himself. At first I thought he really wasn't aware that he had Alzheimer's, so I put the whiteboard up the first day. Well, maybe I'm going to get confused. What day is it? But the great thing is, he forgets I'm angry with him, and 10 minutes later I'm the perfect wife. So the part of his memory that's affected is 3 seconds to 5 minutes. I had to tell all my friends, everyone I know, not to leave messages with my husband. I won't get them. And it took months for some people to, well, I called you, and Dick said he'd tell you, and I never heard from you. Okay, he has memory loss. You can ask him to write it down, and sometimes it works. But learning new things was something I hadn't thought too much about. And I had to teach him how to use a cell phone. I sat with him for half an hour. We did it over and over and over. I'd call him, he'd call me. As a matter of fact, he flew space available out of Travis on an Air Force transport by himself to New Jersey for his high school buddies' reunion because I couldn't go. And he used his cell phone all along the way. Went to the bases, stayed on the bases, found his way to the cars, found his way. That's all long-term memory. He grew up in New Jersey. Long-term memory. I've had people have said, even health professionals in some of the support groups have said to me, you know, Susan, he can't learn new things. Well, that's interesting because I taught him something new. But education is so important. They need people to be aware that if we are going to find a cure for this disease, we need to gather up as many people in the early stages as possible for the experimental drugs. And it's hard. When I see women and I talk to them, I realize that their husbands are definitely past the early stages. And they feel helpless. And they have so much to learn in such a short time. And it will be too late for the relationship. And I fantasize about being single, and I feel guilty about it. But I feel better when I talk to a woman who has just put her husband in a care home after caring for him for 8 years. And she said, my life was not my own, but I didn't realize it until I was able to let him go. Because he's there, but he's not. And I think it is as hard as what a widow goes through because of the physical death. It's the relationship that you grieve. It's just not the same anymore.
So, you know, we talk about Alzheimer's disease. How prevalent is that? Well, in the United States, there's, I think, close to 5 million people with Alzheimer's disease today. And as the population ages, and the fastest growing population is the group that's 85 and above, you're going to have a higher and higher number of Alzheimer's patients. And if you're 65 years old, your risk of getting Alzheimer's through your lifetime is about 10%. And as you go to older and older, it becomes more and more. So there's some studies that suggest that if you're 85 and above, your risk of Alzheimer's is anywhere from 35 to 50%. So it's an epidemic. It'll get worse as time goes on. We're spending $100 billion a year looking after Alzheimer's patients, and it's going to get more. And you look at all the time that's spent, it's not just the money spent to take care of that person, but the families, loss of wages, loss of time. And it's really a social dilemma. I used to tell myself, it's not just a disease of the patient, it's a disease of the family, because the whole family's involved.
My name is Joe Debs, and I am a caregiver, I guess that's the correct term, for someone whom we affectionately call Grandma. Actually, it's my mother-in-law, and it's my wife's mother, but she could just as well be mine. There's really no difference. So we all take care of Grandma. During this challenging times, and Grandma has been diagnosed with Alzheimer's, and as time progresses, we're really beginning to see the changes. It's been pretty difficult trying to come to terms with what's really going on, because if you knew her in the beginning and you know her now, you can see there's been some drastic changes in personality, energy levels, and just the whole person themselves. So it's been real difficult watching the changes come about. We've had challenges that they're wanting to go for a walk. Before, when she'd really been diagnosed, she walked down the street and got lost. Neighbor had to bring her home. Then we went, took her to the doctor, and she had an examination, and sure enough, that's what it was. That was the beginning. That's how we found out. She got lost walking down the street, which she used to all the time. So we have to watch Grandma. One of the things that is really funny, she'll say, do you have a girlfriend? And I say, no, Grandma, I don't have a girlfriend. I'm married to your daughter. I can't have a girlfriend. You sure? I says, yeah, I'm sure. And sometimes she'll say to Jeanette, who's this, your boyfriend? And I say, Grandma, I don't play that. She don't have a boyfriend. She has a husband. That's me. If you ever see a boyfriend, you come and tell me. I will. And Jeanette just looks at me. So she has a real sense of humor, you know. She's from the South, so she has these sayings, right? And she'll always say on a good day, and I tell a joke or something, she'll say, you're a honey dripper. She tells me I'm a honey dripper. What's a honey dripper? It means that you're a little smooth talking. What happens? She calls me a honey dripper. So when it's my turn, I'll call her one. Or a lot of times when we're walking, I'll have to hold her to make sure she's stable. I'll tell her, hold my arm like you're holding your boyfriend's arm. She'll say, I don't have a boyfriend. I don't need a boyfriend. Who has a boyfriend? Don't be done. She knows she don't have a boyfriend, that's for sure. Whenever I make that statement, she comes right back to reality, right? That's one time reality is always there. She don't have a boyfriend. She kind of lets you know she don't have a boyfriend. So I have to laugh, you know. We have some humorous times. You know, a lot of times, too, she'll say, I want to go home. And this morning I said, Grandma, you are home. I say, you're with me. I'm Joe Debs. And she says my name. She always says my whole name, never says Joe, always calls me my whole name. And I'll tell her, say, you're okay. And she relaxes. Yeah, she likes a very independent person. She likes doing her own thing. You know. She can still brush her teeth, you know, do that kind of stuff, do her personal business. And she likes putting on her own clothes, selecting her own clothes. You know, one of the things that is funny, sometimes Jeanette in the morning, she'll lay out the clothes the night before, the morning of, and that's what she'll wear at the center. But if she wakes up and gets an inkling to wear something else, she'll do just that. Clothes you put out, she won't have them on. She'll put on something entirely different, something she likes that day. You know, it's funny because I was joking with Jeanette. Jeanette dresses up like Beyonce, and she looks like Beyonce in the morning. Then she goes and changes and comes out looking like Whoopi Goldberg.
Another area I find in terms of family members dealing with Alzheimer's patients that really troubles me is the fact that the family members do not act cohesively together as a unit. There will always be a sibling who says, there's nothing wrong with Dad. There's another sibling who says, you don't do enough. Although they're the ones that are living in another state and it's not caring for the parent at all. But they can criticize. And that just bothers me. Some people say, Dad can do a lot more than this. Well, my suggestion to them is, take your dad home. Take him home for a week and see what your sister is going through before you criticize your sister for not taking care of your father appropriately.
It's a movie of their life played backwards is the best way to describe Alzheimer's. Their short-term memory is gone. Their long-term memory is now taking its place. They'll be doing things that they haven't done since they were a kid. But it's to them they're at that point in their life. Now, one of the first things I ask a family is, where was she born? And the traumas in her life, because all of these things play a part in Alzheimer's. And some of the other stuff, at the beginning, you're going to find they're going to love sweets. You can get them to do anything by offering a dish of ice cream. And one of the latest things I've been asking families, if they're from the South, is they will never use over 3 squares of toilet paper. And the reason for that is they grew up in an area where they had septic tanks. And Mom's biggest complaint was, don't you fill that septic tank. And one of the latest things that's going on is men won't put their feet in a bathtub. They grew up taking a bath in a wash tub. So that's pretty much whatever they did in their past now comes out. We're averaging 5 to 7 newly diagnosed families a day. And the families are they're just flabbergasted because they don't realize that this is going to happen to Mom. If you want to know the truth about Alzheimer's when you're dealing with families, we always go to the in-laws because the immediate family's in denial. Yeah. Almost every Alzheimer's person is an actor. You can bring an Alzheimer's person in and sit down and talk with you, and you talk to them and you'd swear there's nothing wrong with them because of the generic answers they give.
They'll say, how old are you? Real old. When were you born? They usually can remember their birthday because that doesn't change. They really answer generically. And all my family getting it so young, they all lost their jobs and they were all working, productive people. And it's been pretty devastating for the next generation because 2 in the next generation have it. One has it now, he's just 50 and he's pretty bad, and the niece died from it. So my kids are scared. And when we first started, they told me there was no such thing as familial Alzheimer's. So I started writing letters to university hospitals all over the United States because I didn't know where to go for help. And I got a letter back from Denver. We used to live in Denver University. And not only were they researching Alzheimer's, but familial Alzheimer's. So I went back to Denver for my first support group, and they put me in touch with a lady from Beaver, Oklahoma. and her husband, there were 14 children and 12 of them got it. So we became very close and we learned a lot from each other.
See, and a lot of families will call us, and the fact that we've been at it for a while, and they will say, Mom hasn't gotten combative yet. Well, she might not ever get combative. Because remember, I said it's a movie of their life played backwards. Well, the top 3 priorities for combativeness are the firstborn who's used to controlling the people, the siblings below them, an only child who's spoiled, and someone who's had authority. If they've had authority, when they get Alzheimer's, it escalates. You can't control them. I don't think there's anything that's worse in the whole world than a school teacher with Alzheimer's. Because they're used to control. When they get Alzheimer's, you don't tell a school teacher what to do. And if you're dealing with anybody with Alzheimer's, there's 3 things you don't ever do. First of all, you never tell them they're wrong. You never use the word don't around them. And you never ask them to make a decision. Now, a lot of times they won't eat. If they won't eat, you sweeten their foods. Remember, I said their desire for sweets escalates when they get Alzheimer's. Well, we had a problem in this town where the owners of the facility said, had these 2 guys who just wouldn't eat. And I asked them what kind of sweeteners they had, and they had chocolate syrup. Well, the day we were there, they had meatloaf, carrots, and mashed potatoes, and these guys just wouldn't eat. So I poured chocolate syrup all over their food, just made a sundae out of it, and ate every drop of it. We got 10 facilities now using sweeteners on their foods.
We have 28 support groups, and when we go to one of the support groups to help the people, we learn from them. We learn what works and what doesn't work, and then we pass that on to other people because they have things that have worked for them that we've never even heard of. So we learn something new every single day. There is not a day gone by we don't learn something new.
See, and some of the other things you find when they're in the beginning stages of Alzheimer's is they hide things. And they hide them where Mom and Dad used to hide their valuables because that's what they're working on, their past. And so a lot of times they'll hide things under a pillow, under the mattress. You know they're thinking intruders had to wake them up to find those valuables. And I would say that 90% of the time that's where you'll find it. Now, we had a situation in Florida where they were hiding stuff in the bottom of wastebaskets where they thought intruders wouldn't think to look in the bottom of trash. And some of the other stuff, when I was down in Florida, we had a situation where women were hiding things in their bras. Now, that's not unusual, but they were hiding hot dogs and hamburgers. Because they grew up in the Depression when a hot dog or a hamburger was a good, big thing. So that's where they're going to hide it.
My mother died when I was 13. But then they called it pre-senile dementia. And she was 52 when she died. And most of my family lasted approximately 10 years from diagnosis. And of course, they weren't diagnosed right away. But I was a caregiver for my mother. And I was the youngest of 9 children. And we all had Mom at home. We didn't even think about putting her anyplace. And we all did our job. One of my sisters lived about a block away. She made pads for the bed because they didn't have Depends for them like they do now. And my dad would carry her to the bathtub and he would bathe her. And I would feed her. That was my job, feeding her lunch. And she didn't talk anymore. And her eyes would follow you around the room. And she took forever to eat. And when she don't talk anymore and there's no communication like years, well, you get tired of it. And you're a 13-year-old kid and you want to get outside. So I wouldn't finish feeding her. I'd help her eat it. And when she died, they told me that my mother died of starvation or malnutrition. Well, I thought I had starved my mother to death because I didn't feed her right. And I carried that guilt around for many years. And another thing, I went to visit one of my sisters that had it, and she was almost in the fetal position. And she had her head hanging down like this. And I lifted her head up, and she called me Mama. Well, you know, I thought she called me Mama because we looked so much alike. But now I know that is the first word they learn and the last word they say. And I told one of my other sisters, I said, we got to do something about this, or it is going to wipe us all out. I was one of 9 children. There were 2 boys, and both boys got it. And each girl that came after both brothers got it. And none of the rest of us got it.
We had a guy kill his daughter right up the street here. What happened was his wife died. She was the caregiver. We lose 35% of the caregivers first. So the daughter and her husband moved in with him. Didn't want to move him out of his house. During the night, he came out. She's laying on the sofa. He didn't know her anymore, and he put a butcher knife in her throat twice. Now he's in Atascadero wanting to know how come my daughter didn't come see me anymore. Well, he killed her, and he don't know he killed her. See, and these are some of the things that people are not aware of unless they're told.
The main thing is to look for places early so that when the time comes, you can say, this is where I want Mom to be when the time comes. Because it only takes one time for them to leave the stove on and start the fire, or walk out the house, get lost, and not be found for days. It only takes one time. And people don't realize that they're fine, and then one day everything's different. And they walk out the house, or they leave something on, so they can hurt themselves, and they shouldn't be left alone. And all the medication does is make them a whole person longer.
It slows.
It's not a cure, it just slows it down. And like I said about incontinence, well, that's usually always the last stage. That was the first thing that happened to one of my sisters, so that doesn't mean anything. It all depends on which part of the brain dies first. And usually the last thing to die is when you swallow. And that is what happened to Mama. She couldn't swallow, and she couldn't eat.
See, the cell that controls the body, swallowing is, when that cell dies, they can't even swallow water.
It's all over.
You can't retrain something that isn't there. When those cells are dead, they're gone. Whenever you communicate with an Alzheimer's person, you always hold their hand because they're scared to death. They're flying out there. But you hold their hand, you've scared him.
I think the big thing is to not try to bring them into your world because they're not in your world. Try to go into their world. And people will call me and they'll say, well, how do I know when it is Alzheimer's? And I've said, it's not when they lose their keys. And it's not when they can't find their car. We all do that. But when they get up from the dinner table, go into the living room, sit down and say, when are we going to eat? That's Alzheimer's.
So the diagnosis is made when you see a specialist or somebody who is skilled in diagnosing dementias. And what we do is we interview the patients, we interview the family, and then after that, if we do suspect this might be Alzheimer's, we run a bunch of tests. And the tests we frequently do is a CT brain scan or an MRI brain scan, magnetic resonance imaging. What that does is show us the structure of the brain. So we can see if there is evidence of what we call atrophy, which is the brain's being small in volume, losing cells in other words. We also look for evidence of strokes, because strokes can cause dementia, recurrent strokes. We look for brain tumors. We look for normal pressure hydrocephalus, an increased brain water, which can be treatable by putting a shunt in. So we look for treatable dementias, okay? Then we look at blood tests. Is there thyroid disease? Is there B12 deficiency? Are there infections going on? Because those are treatable. Then we look for any medication problems. What if this guy is taking a lot of Valium? No wonder he can't think. He's half drugged all the time. So we look for all those things you can't correct. After you rule out everything, you're left with a progressive dementia that is a degenerative problem. You have Alzheimer's disease. And then at that point, you label the diagnosis as probable Alzheimer's. We never can say definite Alzheimer's because that's a pathological diagnosis. In other words, you need the tissue to say it's Alzheimer's disease. Because what makes Alzheimer's is the pathology. Okay? The disease is named after Dr. Alzheimer, a German neuropathologist, psychologist, if you will. At that time, it's all rolled into one. And it described the first case as a 51-year-old woman who developed progressive memory decline and behavioral problems. In the autopsy, she had these, what we call plaques and tangles in the brain. And that's the hallmark of Alzheimer's disease. Because she was 51, it was known as presenile dementia at that time. But later on, as we have people with senile dementia have an autopsy, we find out the pathology is the same. So now we call it Alzheimer's disease. So what are these plaques and tangles? Well, the plaques are made up of an amorphous group of protein called amyloid. It accumulates in our brain, and it is toxic to brain cells. The tangles are abnormal neurotubules. They're abnormal proteins that form tangles, and they look like little wires in the brain, and they also produces damage. So these are two hallmarks of the disease. To this date, we don't know how to stop the amyloid and the tangles from accumulating. That is why we don't have the cure for the disease still at this date. Well, we do have medications that can help with some of the symptoms of the disease.
Okay, my name is Jim Drennan, and my mother contracted Alzheimer's. I think it was probably 1986 when we first started noticing the symptoms. I'm an only child, and my mother and father lived in Bakersfield, and we saw each other once about every 2 months. And my folks are up here visiting, and she came into my bedroom first thing in the morning and said, "Now, do Eva and Bess live here with you?" Well, those were her sisters who lived in Modesto, and that was an earth-shaking event, because I realized something was really wrong, and I mentioned it to my father later in the day, and he said, "Well, Mother has been having some problems," and I said, "Well, I think you ought to get it checked out," and so I guess he took her to the doctor, and the doctor diagnosed that she was suffering from hardening of the arteries in the brain, and that the only thing that would be done for it would be to give her an aspirin a day. And so we left it at that. Another couple of years later, I think it was 1991, I got a call on a Saturday morning, and it was a friend of my parents, and they said, "You know what's going on with your folks?" And I said, "No, I was just down there and they seemed fine." And said, "Well, your mother attacked your father with a dustpan because she thought he was a burglar." And this is someone she had known for 65 years, had been married to for more than 60 years. So I got in the car and headed down to Bakersfield. And my dad said that, yeah, Mom had been wandering away in the night and was really starting to show some signs. One of the ways that I knew that something was wrong was that she had always been very neat and tidy, and bathed regularly, and took good care of her clothes. Every time I went down there, she was wearing the same outfit, and that it had been stained, and she was not taking baths. Well, my dad said, "Well, I've been giving her a sponge bath." Well, I don't know what that amounted to, because she was really starting to smell, and this was so completely unlike my mother. At any rate, a few months later, I went home for Christmas Eve. I took the train home, and my dad picked me up at the station, and took me over to the house, and there was my mother, and she had defecated on the furniture in the living room. And so my dad cleaned it up, and we went out to Christmas Eve dinner, which has got to be about as dismal a Christmas Eve as anybody could ever imagine. I think I felt lost. Lost is probably the best word for it. Even though we had the diagnosis, I felt a sense of relief in that we had the diagnosis, that that we knew what was going on. But it was a terrible diagnosis. I just knew that, nonetheless, I just knew that the neurologist, the doctor, we said, now what's the course of this going to be? Now what's the big deal? And the doctor said, someday she'll wake up and she won't know who you are. And then someday further along, she'll wake up in the morning and she won't know who she is. In some ways, it's still the same person, but in other ways, it's a different person than the person you were used to. And I think that the complicating factor that certainly affected me and affects a lot of children of Alzheimer's patients is that the change in the relationship, the parent-child relationship. Well, we are used to doing what mom or dad tells us to do, even in adulthood. I remember when I was 50, my father insisting that I buy a certain kind of car and not buy another kind of car. And I'm kind of like, wait a minute, I'm 50. But, well, he was used to telling me what to do. But I think that with his caregiving of my mom, I accepted things and failed to challenge him on things that in retrospect I realized I should have challenged him on. But the question is, how do you convince your parent to do something they don't want to do, even if it's for their own good?
I think the tragedy is frequently the child becomes the parent. So that this is somebody that you respected all your life, you listened to all your life. Now you have to turn around and tell them what to do. And of course you meet resistance. Who are you to tell me you're my kid? But sometimes you have to suck it up and do it. I think that it's not until later that the Alzheimer's patient doesn't recognize their loved ones. During the beginning, they still recognize them and their relationship, and they will insist upon keeping that relationship the way it was. And it's difficult for the family to deal with. I remember a family where the father starts not recognizing the daughter and thinks she's his wife. Even start making advances to her, which make it extremely difficult for the daughter to deal with. And here she is trying to take care of her widowed father. Sometimes if the person's belligerent and even physically abusive, then we have medicines to maybe calm people down a bit. But a lot of times it's a behavioral modification. It's to distract them away from what is making them angry and just take a time out. These are the challenges, I think, of treating Alzheimer's disease. Sometimes much more than selecting the right medicine is helping the social situation.
My name is Rebecca Alfaro. I'm 40 years old. I have worked at the Alzheimer's Center. I have been with the center for close to 8 years. And what we do at the center, we do the clinical diagnosis for people with Alzheimer's. We are one of 10 centers in the whole United States, and we are going for the research. We do research on people with Alzheimer's. So I am pretty much the face of the clinic. I am the first contact the patient have and the last contact they have. In a way, I try to guide them through the process. When you come to our center, it's scary. You see the word Alzheimer and you worry. You don't want to be there. So we try to make it as pleasant as we can when you come to the center. I have formed a lot of relationships with the patients and the caregivers, because once we get a diagnosis, some of them are asked to participate in the research, and we follow them year by year. What is so interesting about the disease is I feel it is the caregiver who needs the most support. I have had caregivers say that as soon as their loved one is diagnosed, people try to pull away because they don't know how to deal with that. They keep saying it's learning to accept the person in a new way because of the changes of the disease. They are not the same people that you have memories of. Well, we had a patient who came into the center with his family, and he had 4 girls, and they were sitting in this office and he was in the front. And we had to bring him into the family conference, and they had to bring him right back out again because one of the girls was crying, and he was getting kind of upset to see the daughter cry. And I was in the front, and he said, "You know that girl on the end? She is my youngest. I don't remember her name, but I know we have a special bond. And I want to tell you that growing old doesn't hurt. I want to tell her I still feel like I am 21 going into the army with my uniform. I want her to know that I am okay, that growing old doesn't hurt." Well, I got hooked. I really got hooked with the patients and the caregivers. I am pretty blessed to talk to these people every day. I feel I have so much to learn from them. And what is so amazing are the people that are providing one-to-one care every day. And the ones who amaze me the most are the ones who go above and beyond what they have to do. Because like I said, it's learning to love that person again and again and again. And as soon as you have it figured out, they change the behavior. The main thing about the caregiving is that if you are providing 24 hours a day care, you need some relief. And if you don't get that from the family or pays people to help you, then it is time to find a decision, to make a decision. And that may be going a few hours into a daycare, and we have great daycare in this area, or into a nursing home, whatever the caregiver needs at that time. And that's a process. That's another goodbye at that time, because that's a new way of life, a new way of living without the loved one around. I think it develops in its stages. I clearly see that every day. And I kind of hate to say it, but I kind of like it when the patient is in a happy place. I really hated the idea that at that stage of the disease that they know what's happening. It really makes me heartbroken because they know they are changing. They know they are not the same person. And they try to compensate. And a lot of the patients, they are so smart. And they try to compensate. And that gets tiring for them. And then they just move to the next stage where they are at ease with themselves. They are who they are in that moment. And that's hard. That transition from them to know to them to be in a happy place. And of course that's a problem for the caregiver too, because you have to provide more care. But we had a caregiver who said, "You know, my mom doesn't think she has Alzheimer's. She thinks we have the Alzheimer's." And that's correct, you know, because the disease takes over everybody else, you know. So, and then the patient just gets in a good situation where they're acting the way they're acting. We had a patient, we discovered that she loves to dance. And so her son would come every day and dance with her for half an hour. And that was the happiest moment of her day. And it was, you would show her a toothbrush and you would say, what is that? A ballerina. A watch, what is that? A ballerina. Everything is a ballerina. It was the cutest thing to see. And the daughter said, yeah, she loves to dance. We had another patient too. They finally had to place her in a nursing home. And for the husband, it was hard because what happened to her, it was, she felt like she was in college. It was the happiest she had been in years because she didn't have to be somebody else. She could be who she was in that moment. She had friends she could relate to. She felt like she was in college. And for the family, it was hard. For the husband of 50 years, but she couldn't relate to him anymore. She had to relate in her mind. And in her mind, she was in college. And all these people were her friends.
I think the greatest challenge that comes with a person or a family with Alzheimer's disease diagnosis is the fact that you know you're at the tip of the iceberg. You know it's a progressive condition. You know it's going to get worse from here. And you better prepare yourself for it. And you know it's going to be a long ride. It's going to be time consuming. It may mean that you have to quit your job so that you can take care of your father or mother. It may mean you have to put up with abuse from the person who's sick because they have behavioral problems and don't know about it. I think that's the greatest challenge for the family, is to brace themselves of what is to come.
I have not changed. Those around me have changed. I am a victim. I no longer exist in the lives of those who have heard. I don't notice any behavioral changes except my anger at those who don't know what to do, and they can't, and they treat me with fear. The greatest challenge is surviving the label of Alzheimer's. I don't really have any what I would call good days that I have had in my past. It's just that big A word that comes to me through how people look at with me and they treat me. And well, I took a lot of psychology in school, and so I'm aware and observe. And you have a question here, this question here. What advice would you offer others with Alzheimer's and their families? I wouldn't wish this title on anyone. It's man's inhumanity to man personified, having this disease. It is beyond. I took a lot of psychology at school at Berkeley and personally, and this situation is man's inhumanity to man when someone is diagnosed as having it. I wouldn't wish it on my worst enemy.
It was two people. Our daughter-in-law, who works for a medical group that we go to, our family doctor, and we're very active in our Catholic parish. There's a nurse, a retired RN, who was in our group, and she kept telling me that she called me up one day and told me that Marianne had Alzheimer's, and I just, it was a shouting match over the phone. I didn't want to hear this. I didn't want her telling us this. For a few months, our relationship, mine to her, was on hold. I don't think I even mentioned it to Marianne. I was so upset. And our daughter-in-law kept hounding us to go over to see the doctor. And so the three of us went, Marianne, myself, and our daughter-in-law, and the test they did to come up with this family doctor preliminary thing was so childish and so naive in terms of what the consequences for being so diagnosed are. I mean, they basically ask you, they have a listing from at this level of medicine. Do you know what day it is? Do you know what day of the week it is?
You know, I am someone who's got a degree from Berkeley, and well, who could care less about that kind of crap? You know, I've been through it, you know, and if it were a more important statement, I would remember it, but that's ridiculous. I've been that way all my life, right, Jerry?
Yeah.
Yeah, and
we're both, so go ahead.
Well, I'm just too serious, you know, and what's so funny is the test, the thing to show you, well, to demonstrate what I'm trying to say is, the doctor was just adversarial with me. I would ask a question, he would give Jerry the answer.
Well, this is the final super specialist.
No. Let me tell my story. Oh.
Yeah.
Okay. So this same doctor, okay, he had me in one of the tests and so on and so forth. And the last test that they give, the woman took, she gave me this little thing, and it was no ifs, ands, or buts. And then she went on and she said, what was that? I remembered it because my dad and mother always said no ifs, ands, or buts, and so I failed the test and I couldn't go in.
The drug trial.
And do you understand? And so they were upset that they knew I was a candidate, but I passed the test, and so I didn't qualify. Do you understand? And so this is the basis for putting me in this category. I mean, poor Jerry. He's been married to me. He knows what I'm talking about. I say you gotta want it. If you don't want it, it ain't gonna happen. And I'm there. I'm that way about some things. It's not that I don't know. It's that I just don't want to. And that's probably a disease in itself, but then that's my strong personality, and I'm strange. I mean, Jerry will tell you.
Can I amplify on that? We're both very energetic people, very serious about all dimensions of life, whatever it is we're doing. And we ran a bed and breakfast for 18 years there. And we're both full-time ministers in our church, and ran an engineering research corporation that I was president of.
I did all the books.
And she was the business manager. And we have all of our kids and grandchildren that we interact with. And, you know, so we don't have time for fooling around. Maybe that's a weakness. But this whole process has treated us like we're children. It's so immature and childish in terms of the tests and the dialogue you have with the medical personnel and our family doctor who she's leaving and going to a new one because I won't go into all the details of why they're all screwed up, but once they put that in her record, everything changed about how they treated her and I and us as a couple. Now they're worried about liability. They dance around it. Now, you have to go in every time she goes in because she won't remember it. You know, and it's just downright insulting.
You gotta want it.
Nobody talks about it with us there. They just dance around it. Now, the same thing happened when we decided to get psychological counseling.
Oh.
So through a process, I found an excellent man in Fresno and he sat with Marianne and talked with her and tried to find someone who could help her. But the mistake he made was thinking that the someone who could help her had to know about Alzheimer's. Bad mistake. She was the co-director of the Central Valley Alzheimer's
Confrontational. She was confrontational with me. Instead of asking, well, why is that, Marianne, you know, and digging deeper and getting understanding of how I came to my conclusion, she was adversarial. It was unbelievable. Jerry experienced her.
So she invited me. She wanted me in the last 2 sessions she had with her, and I was stunned. She was not interested in Marianne the person and how can I help you psychologically. She wanted to make sure that Marianne knew just where her spot was in this Alzheimer's situation. Every doctor that we encountered saw her as this poor thing who's got this horrible disease we can't fix. And it was more than one doctor who, when she would ask a question, would turn to me and answer it. I actually had to sit behind Mary Ann so that the medical personnel wouldn't keep looking at me the whole time.
They're afraid. It's bizarre. I mean, that's the only way I can explain it. You know, they know less than they think they know. They really, and so they're afraid of this disease. That's my take on it. The majority of these doctors, and you know, what's so strange is I don't feel I have it. You know, but everyone who sees that I've been diagnosed as having it, they don't want it, and so they're afraid, and they don't see what's happening, and I can't explain. I know what I mean, and it's just that I know when somebody is that, and I've always been pretty
accepting,
you know, aware of people anyway, and it's, oh, I'm so glad it's not me, and so they're interpreting. They're not hearing what I'm saying, or they're hearing it in terms of maybe, oh, well, what did she mean, or I don't know. It's bizarre. And I'm someone who took a lot of psychology at school. I went to Berkeley, graduated from Berkeley. I took a lot of psychology. I ask a lot of questions, and I know a lot of us do. And I know awareness. This is something I came up with by myself. Awareness is not knowing all the answers. It's asking all the questions. And I guess that's why I'm observing people who are asking questions about me.
Let me take a different tack here. I was scared to death when they told me that Mary Ann had Alzheimer's, because there's this big void of information about what's going to happen they can't tell you. Except they can tell you what the end game is, and it's horrible. They put you in a home somewhere and you're not able to take care of yourself. So I've had to observe her. But here's the point with you gotta want it. We use so much of our brains, have all our lives, that trivia goes sailing right past and doesn't get much use in our brains. So we don't even think about it. But what I've been observing in these early stages is that things that don't matter to her, she doesn't retain. But things that do matter to her, she does retain. This is more complex than they're willing to want to understand the functional side of it.
Well, he got that because I say you gotta want it, and that's essentially
that's a struggling to
well, you
understand
heard
that.
me say that, and to think about it, and that's he said. Well, I understand that he came to that because I say you gotta want it, and if well, he knows I want it. Do you understand what I'm saying here? I want my my stability to get my. I want to get through this, okay?
She doesn't want to be treated as if she's defective.
I am aware.
She wants to use her life in the maximum amount she can. So this is where we are.
I did all the books for Jerry's business, for his corporation, for the bed and breakfast, for everything else. I paid all the bills. I still do.
Now, more and more Alzheimer's patients are taking jobs on advisory boards, committees, and as they admitted, we're at the brink of it right now. The emphasis is shifting, thank God, to where is the life going for the people who have it now? What can you do about your quality of life now? Not, oh my God, it's all going to go to hell soon. Have you got your records in order, your power of attorney? You know, have you got enough money? Well, you have to sell your house. It's like it's an impending shipwreck, and they're not dealing with you where you are now. I hope that what I'm saying is that there is a missing piece of information that has to be filled in for the people who've been diagnosed. But in the last 5 months, I haven't noticed any new symptoms or any intensification, except that she says of her anger.
My anger.
She's really struggling with the anger issue.
Well, I feel like a little kid who says it ain't fair, and it ain't fair.
The whole meaning we're trying to bring here today is that people who can share this common bond and who can be painlessly open with each other see a different person and see each other differently than the rest of the world that's going, oh my, and trying to treat you once they put that label on your forehead.
I was taught to embrace whatever it is, you know, and however one embraces it. In other words, not denying it, but embrace it and say, this is how it is. It's not how others see it. It seems to me, well, that means, oh, she won't talk, you know, or she's going to lose it all. But it doesn't have to be if you embrace it and say yes. And I think that's what I've done. I've embraced it, but I am not laying down and saying, oh, okay, do whatever you want with me. No, I'm still myself, hanging in there. I don't know if that makes any sense, but I know what I mean.
That's a kind of an internal answer. I think the external answer is to try to find some trusted old friends or somebody who you're reasonably close to or who has this disease or a similar one and start forming relationships. Let's see if we have something more in common and they'll understand and we'll understand them. As I've sort of tried to say, this, what do you do now with your life? But how does that message get out? It's like there's a big void of information of what to do till the train comes, you know? and I don't know how that void is going to get filled, except at a very personal, local level of what we're doing with our lives. I'm sure there's lots of other people, other families who are suffering worse than we are because of this isolation and misunderstanding and everyone's tiptoeing around them. So you've got to start doing what we've been doing the last couple, 3 months, is breaking through the bubble and taking the risk of talking to some people who you know or you trust or who have similar problems. And it's giving us a lifeline. Yeah.
I have to tell you that over the years I had some cases which sticks in my mind, and one case was a gentleman that was a musician, and he's an accordion player, wonderful player, and he taught a lot of people in this area to play the accordion. You know, how many accordion players do you know, right? So and he would play for benefits and things of that nature. And he developed Alzheimer's disease. And in his early stages, he still played the accordion. And actually, in the Alzheimer's walk, he was playing the accordion in the Capitol steps, and lo and behold, someone in the audience was his former student that came up to say hi, and it was a really touching scene. He kept it up for a few years, but after a while, he started having trouble keeping track of the song. He would stop playing one song and go into another song and get mixed up. It was kind of funny and tragic at the same time. But I always remember him because he's a very nice fellow and a funny fellow. And I'm a musician myself, so I always bond with the musicians. The one thing about music is you can always try to play music and do music no matter what degree of dementia you are. I still have patients who are quite demented to the point where they need help with all their meals and finances and still play in a symphony, a local symphony, not first chair anymore, but still play, still sing in the choir. And you know, I'd encourage people to do that. Do what you can do and what makes you happy. Just because you have short-term memory problems and eventual long-term memory problems doesn't mean you cannot enjoy what you like. And I encourage people to pursue what they can do until they can no longer do it. And there's some nihilist that says, why even treat these folks? You got a disease that's going to kill them anyway, so why bother? Well, it's called quality of life. It's quality of life not just for the person, but for the family. And I think as physicians, we have the duty to provide quality of life. And that's how I see it. In any case, despite these unpleasantries, I love what I do. I enjoy helping families navigate through these rough waters. I enjoy making a difference, making quality of life for the patients. And that's why I do what I do.
so much, ladies and gentlemen, for joining us here this evening for the premiere of Sweetening the Broccoli and my master's thesis project. We're so happy that you were able to join us. We know that you've been sitting a while and maybe need to stretch your legs. We're going to go ahead and bring out some chairs now, except for Blair. He has to run out, but he has a good excuse. And do a talk-back question and answers at this time. If you need to get up and leave for any reason, don't feel obligated to stay. We won't be offended, but we would love to hear your feedback and answer any questions you might have at this time. Thank you.